I'm very pleased to welcome Dr. Rano Matta from Sunnybrook Health Sciences Center. He's going to be talking about understanding the quality of life and continuity of care for people with congenital neurogenic bladders. So Dr. Rano Matta is a reconstructive urologist at Sunnybrook Health Sciences Center and an assistant professor of surgery at the University of Toronto in Canada. He completed medical school at Queen's University in Kingston and his urology residency at the University of Toronto. Subsequently, he completed fellowships in pediatric urology, injury and reconstructive urology at the University of Utah in Salt Lake City. He has a master's of science in epidemiology from the Institute of Health Policy, Management and Evaluation at the University of Toronto, where his research focus was on functional urology and prostate cancer survivorship. Dr. Matta's clinical and academic focus are care for adult patients with congenital urologic disease, genitourinary reconstruction for cancer survivors, and urethral stricture disease. So please welcome Dr. Matta and his presentation. Thank you for joining us. And sorry
for inviting me, Shauna. I really appreciate it. And it's such an honor to join the meeting today. And I've heard a lot of inspiring stories from Gofran and our speaker earlier, and lots of learning on my part watching the last presentation about transition. So let me just get my slides up here. Okay, hopefully you all can see that. So, yeah, great. Okay. So I wanted to do a quick talk. I know we're running a bit behind, so I'll speed through some of this. But a lot of the work that we've been doing across a few different institutions in the city of Toronto, looking at continuity of care and transition for people with congenital neurogenic bladder. And then just thinking about sort of quality of life in adult patients with these conditions. I don't have any disclosures, and these are the objectives of what I want to talk about today. And so the first thing I want to talk about is understanding the challenges that exist around transition from pediatric to adult care. And I'm sure lots of people here are familiar with all this already, but the large majority of people with spina bifida survive into adulthood. In the USA in 2020, there's 125,000 people with spina bifida, and the majority of these people were adults aged 30 to 80 years old, about 66% of them, 2/3. So it's important to focus on what happens to people with spina bifida when they become adults. A lot of focus has been placed on managing pediatric patients with the condition. And so, what happens throughout life for people with spina bifida? Well, what we did in a study back in 2020 was we kind of followed the money. And we looked at costs associated with outpatient visits, inpatient visits, surgical costs, and emergency department costs. And on that lower axis of the graph there is the age in years. And you can see that gray bar highlights that sort of transitional period, age 18 to 26. And you can see here for a lot of the costs, there is sort of big movements happening around that transition age. Outpatient costs are the lowest during that age. So people during their transition age, when they're becoming young adults, are not really going to see primary care or specialists in the office very often. The inpatient costs are also kind of dropping. So maybe they're not being admitted to hospital very often either. But surgical costs do start to rise again during this age group. And that probably represents, some issues that come up as people transition from being at home and dependent on their families to being out on their own at university or in the workplace, and also the changes that happen to one's body as they go from being an adolescent to an adult. And then the one that was sort of most alarming is the use of the emergency department. You can see it starts to rise and kind of has a bump around that transitional age group. And we saw this when we looked at Ontario data as well. So this is data across the whole province of Ontario of patients with spina bifida. And what we saw was that around age 18, so that red line down the middle of the graph here, you see that emergency room visit numbers are going up, and hospital admissions are going down, and surgeries are pretty stable. And so this got us thinking, what else is driving this other than turning 18? And obviously, I think we can all intuit that it's really related to the transition that happens from pediatric to adult care. And so this brings up the idea of transitioning. And so the goal of transition was well described back in the early 90s, and it was really to provide purposeful, planned, timely transition from child and family-centered pediatric healthcare to patient-centered, adult-oriented healthcare, and really to make this seamless. So for people with a congenital disorder like spina bifida, there are multi-system issues that are degenerative with age, and people can have a lot of difficulty with self-care and independence in adulthood. And so it's important that whatever care comes into place helps them transition into adulthood. So to start, it's good to understand the difference between, these two terms, transition versus transfer. Transition is really a purposeful planned movement of somebody with a health condition from pediatric to adult care. Transfer is really just a one-time event. It's kind of like the final goodbye at one provider and a hello at another provider. So really our goal is transition rather than just transfer. And there's lots of different models of transitional care that exist in the world right now. And they go along a spectrum here. So, they're anywhere from a pediatric doctor or team sending a referral to an adult physician when a person turns 18, all the way up to a comprehensive multidisciplinary clinic that has adult and pediatric doctors present and sort of providing care at the same time. Now, I'm sure everyone here is familiar with this, but the care that people receive in the pediatric setting is often quite different and quite the opposite of the care in the adult setting. And the question is, does this difference really drive some of the increased problems that happen around the time of transition? So, pediatric care is usually multidisciplinary. Adult care tends to be siloed amongst different providers. The care approach in the pediatric world is very family-centered, but in the adult world, it's very patient-centered. And in the pediatric world, obviously, some of those patients have limited independence, especially when they're quite young. But in the adult world, the expectation is that people are relatively independent, and so that can create some barriers to appropriate care. Just thinking about the logistics of how care gets provided in the pediatric world, if you've ever attended a spina bifida clinic, that's a full day event. It's a one-stop shop. You go and see all your doctors, all your providers, and you get it out of the way. But in the adult world, unfortunately, we don't have those kind of models in place very widely. And so you tend to have very focused appointments that are dispersed throughout your week at different locations, different sites, and these tend to be quite short visits. And then in the pediatric world, at least at a specialized pediatric hospital, there tends to be pretty good access to all the allied healthcare providers, psychology, physiotherapy, occupational therapy, etc. But in the adult world, that becomes a bit more limited. And then when it comes to follow-up, the follow-up is quite active in the pediatric world. Often you're being seen every few months or once a year. And in the adult world, the follow-up can sometimes be a bit variable depending on, who's providing the care. So what are some of the barriers to transition? Why is it so difficult to transition from pediatric to adult care? Well, people have looked at this and they've identified a few different problems. One is that child-centered healthcare providers have sometimes an inability to let go. You form very strong connections with your patients, and it's hard to, let them go out into the world, so to speak. There's also a distrust amongst providers and patients of what happens in the adult care world. There's often a lack of planning and a delay in determining when a person is ready to transfer to adult care. And obviously, like with everything in life, we don't like change, and there's a reluctance to leave a familiar setting. And then one of the big shortcomings, I think, although not so much anymore, but there has been a lack of interest or training among adult providers to help people with congenital problems. And so what I want to talk about next is some strategies to improve the pediatric to adult transition and what we've tried to do in Toronto. So some strategies that have been discussed to improve the transition is to make sure that there is adequate preparation of the patient and the caregiver so that everybody kind of knows what's coming down the road. The other thing to consider is that, although our system forces the age 18 as the time of transfer of care, transition can be flexible. So, transition can begin much earlier at age 13, 14, 15, whatever is really appropriate for the patient and the family, and can continue beyond age 18 with some overlap in care. And it's helpful to have early introduction to the adult clinic or the adult providers, and to have an adult clinic or a provider that is really dedicated, and then to have knowledgeable, interested providers as well. So we've thought of some of the goals that we had for a transitional care approach, and these are some of the strategies that we use to meet those goals. And we wanted to provide equitable, efficient, and effective care. And to accomplish that, we have tried to make a transition clinic easily accessible and one that does not really limit patients based on geography or finances. We want to make it so that the clinic is efficient for the patient and kind of try and implement a bit of that one-stop shop approach. And to also make it efficient, we do a lot of pre-review of the patients amongst ourselves as a group, so that we're not spending a lot of time doing, information gathering when we're talking to the patients, but kind of getting down to business. And then lastly, we want the care to be effective. So our goal is to really make sure that this transition clinic provides seamless care from pediatric to adult. And it really helps establish trust between the patients and the providers in the adult world. So this is an ongoing effort between Sick Kids and Sunnybrook Hospital and Bloorview Hospital. And a lot of the effort began before my time joining Sunnybrook, but it began all the way back in 2013. And this is a nice timeline that Abby Varghese, one of the nurse practitioners at Sick Kids Urology, put together, showing all the work that sort of happened leading up to the pandemic. And then things kind of, halted during the pandemic, but it was a bit of a blessing in disguise, because what happened and what came out of the pandemic was virtual care became the norm. And that really opened up a lot of ways that we could accomplish those goals that we had. And so in 2022, we started a virtual urology transition clinic. This is a nurse practitioner-led clinic that's done in collaboration with a team social worker, and it's supported by a medical urologist, as well as Dr. Chua, who's a surgeon, urologist at Sick Kids, and myself at Sunnybrook. And the intention is really to adequately prepare urology patients with chronic conditions who are older than 12 years, and to really prepare them for the transition or that transfer of care that's going to happen at age 18, because unfortunately our system is a bit inflexible about that age. So we get started nice and early. And a lot of the patients that we're seeing in this clinic are patients with spina bifida and neurogenic bladder. And this is a clinic that we've run quarterly for the last 2 years. And what happens is we meet with all these providers. Sometimes there's other people on the patient visit. And we sort of do that one-stop shop approach where we all get together, we meet and discuss the patients who are being seen that day in the virtual clinic, and then we all see them together on the same call. And then there's some overlap in care that happens where patients will continue to go see their doctors at Sick Kids. They'll also start to see me at Sunnybrook around the age of 17 or so. And there's a nice overlapping care at Holland Bloorview, where they see Dilshad, one of the nurse practitioners at Holland Bloorview, who does adolescent care up to age 25. So there's a lot of overlapping care so that people don't fall through the cracks. So what's next for this clinic? Well, our hope is to make it more multidisciplinary, to start including other services that we think are relevant to the care we provide, and colorectal surgery, gastroenterology, physiotherapy, occupational therapy, chiropody, physiatry, all the specialties you might see at the pediatric spina bifida clinic, for example. We're also working on securing funding to support this work and to support research around this work, because that's very important in this space. And some of that funding will help have a clinic coordinator to facilitate transition on the pediatric side. And we also need to secure somebody on the adult side. So we're working on those things. And then the last thing I want to talk about is really understanding the quality of life related to bowel and bladder function in adults with spina bifida. So what do we know about this topic? We know that people with spina bifida continue to have urinary and fecal incontinence into adulthood, and that they have a worse quality of life because of it, and that people with spina bifida undergo more surgeries in adulthood, and they have complications as a result. A lot of this information comes from this National Spina Bifida Patient Registry, which is a large multi-institutional registry in the United States across all these different centers. These are specialized centers that look after patients with spina bifida, and they're primarily pediatric hospitals. But one of the big things that came out of this large study in the States was that 68% of adults with neurogenic bladder related to spina bifida are incontinent, and 52% of them are incontinent of their stool as well. Another thing that came out of it is that these things get worse as patients get older. We see increasing levels of fecal incontinence with age. We also see increasing levels of urinary incontinence with age. We see increasing skin breakdown as well, and then decrease in the ability to walk around without assistance. And so, there is lots of information that things change over time and potentially work towards making quality of life worse. We also know that patients get more surgery as they get older. And so you can see here between age 1 and 18, the rate of surgery is relatively stable. But once you start to look at age 20 to 24 and over 25, the amount of surgeries that become required increases pretty significantly for patients with spina bifida. When we look at how people manage their bladder, in the adults, the majority of people use intermittent catheterization. A lot of people, about 20%, are on daily antibiotics. About half of people are on antimuscarinic medications to relax or control their bladders. About 5% of people end up requiring some form of stone surgery, and about 20% of people have had a bladder augmentation. And with Botox, that number has probably dropped a bit in the last 5 to 10 years, but now a lot of people are on Botox injections in their bladder. So we do know a bit about what happens in adulthood for patients with spina bifida, but what's really missing is how all these things can affect people's quality of life. Because ultimately we're trying to make sure that everybody has the best possible quality of life that they can. And so as part of this neurogenic bladder research group, which is a multi-institutional group of urologists and other specialists from across Canada and the US, our aim is really to establish a multi-institutional study of adult people with spina bifida, so people over the age of 18. And our first goal in developing this research study is to understand bladder and bowel management related outcomes and quality of life. So this is something that's just starting up this year, and we'll hopefully reach out to Hydrocephalus Canada to help recruit people to the study. And what we hope is that this will help us understand better the adult care of people with gastrointestinal or genitourinary conditions in spina bifida, and then ultimately help us figure out solutions that can improve quality of life. So that's all I had to talk about today, and hopefully you're just as excited as I am about what's coming down the pipeline.
Thank you so much, Dr. Matta. And yes, we are very excited to see what's coming down the pipeline. I don't know, I think we talked, and I've been with the organization for 30 years, and there's been a lot of ups and downs with trying to get adult clinics established for spina bifida and hydrocephalus care. And I know that I've been working with, or not just me, but our organization has been working with Sick Kids in Holland Bloorview for years to get a clinic established as well. So, or our organization would be happy to help in any way. Whether it's a letter for funding or recruitment, we are there beside you.
Thanks so much, Sean. I really appreciate that. And I will, I'm going to take you up on that offer hopefully soon.
Absolutely. I don't see any questions here, Dr. Matta, but if you do have any questions, you can certainly email me, and I can reach out to Dr. Matta, and we can get your questions answered. So thank you so much. This is an important research topic, and I'm so happy that we can share it with our audience.